And that, ladies and gentlemen, a good transition for what's in your genes. We're finding out all kinds of things these days. Here from Gravity Diagnostics is Tony Remington. Now, they do all kinds of testing in his lab and a bunch of other things as well. But today, Tony is joining us because they have a real focus on helping you get precise information for certain things such as proper depression medications. They also have several projects in the works such as genetic testing studies for people who might become addicted to certain medications. And one of the things that we try to do with this show is really to let people know the cutting edge of medicine. And if there's a place on it, it's Gravity. So good afternoon to you.
Yeah, thanks for having me again. It's good to see you.
Yeah.
I think it's important to say that the awareness that's been created by these new genetic companies that are going direct to consumer via online kits and things like that, I think they're creating some good awareness around the role that different types of genetic testing can help in creating helping with preventative medicine, right? Instead of a reactive kind of once you're already in the ICU in a hospital and you need a genetic test for some reason, whether it's how you metabolize a blood thinner or something like that, right? I think these companies are kind of creating some good awareness and makes it more acceptable. But I think you got to be careful, how you share that information. And, at Gravity, we're really committed to partnering with the clinician to make sure that there's an expert involved with that report or with that result. So if you get something in the mail that's a report, there's someone there with you, an expert, to help you, guide what that information means.
And we appreciate that about you, because I've done a number of stories where people got information, made an interpretation that wasn't necessarily accurate, and started taking medical action, from breast cancer to whatever else. So let's just kind of reintroduce you to our audience. Tell us what your goal is sort of with Gravity Diagnostics.
So, in general, we're just passionate about helping people and trying to get diagnostic testing to be viewed as more on the wellness prevention side of healthcare. So historically, the way healthcare works is if you need a diagnostic test, it needs to have some sort of medical necessity. So right now, if you said, I want to get an MRI just to see what's going on, you're healthy. You don't need an MRI. No one's going to pay for that MRI, right? So a lot of the diagnostic testing we do is viewed similarly, but it's benign. There's no adverse event. There's no risk on a safety side. So we can quickly swab your cheek and give you a roadmap for future healthcare decisions you might need to make. You have a catastrophic event, you, God forbid, you get in a bike accident or whatever, and then you have that information, that genetic information on how you metabolize medication as an example. So we've always been kind of committed to partnering with the community, the government, the payers, and really trying to, we applied for a National Institute of Health grant to try to dig deeper to have better information ahead of time. So when you see a physician or you see a clinician, getting that information to you before you might need that
Which
medication.
is really enlightening, because usually you go to the doctor and you say, tell me this or that, and they can't, but having that guide would make a huge difference. We do have a little video of your lab. We should tell people that you are local. Tell us where you are.
Covington, Kentucky, licensed in all 50 states. 5 minutes from here, I guess.
I know. Well, and you're kind of a really well-kept secret, because people aren't necessarily familiar. We have this amazing place, looking forward to the future in our own backyard. So tell me, I think probably the two things that we highlighted a little bit about testing for, who might become addicted to a painkiller, which is fascinating, and you're working on that. But the depression thing and things like that, how, if I went to my doctor, would I request that test through you, or what would happen?
It's hard to do that in a minute, but I'll just say this. I think our vision and passion and just kind of, our mission is to find a way to get people the necessary tools they need to make sure that when they need a medication, because there is a role for medication in healthcare, they have all the information they need to try to get that dose and drug right the first time. And if you can get, it takes all aspects of, whether it's treatment, recovery, there's all aspects of the spectrum here. But what we feel isn't being done enough of is before you get that medication, make sure that patient has every endpoint they possibly can have to get it right the first time. And that's really what we've been doing for 3 years. And we're a small company. It's hard to,
but you're a small company doing great things, because, for example, if you take someone who has been on antidepressants, they will often tell you, I've been on 6 of them before I found one that worked. In the meantime, I gained weight, I felt worse, I got more depressed, whatever it is. So what you actually have is something someone could ask their doctors about, which is, if you're headed toward one of these medications, ask your doctor to do this lab run ahead of time.
Yeah, at the end of the day, by the way, what a great show today. Everything's kind of intertwined, right? Whether it's eating disorders or recovery or diet, I think in the end, mental health, behavioral health, pain addiction. It's all kind of interconnected, right? And so I think getting as much information you can in the beginning before you get a medication can be helpful. And I want to be clear that I'm not a scientist, I'm not a PhD, I'm not a medical doctor, but in a simple form, you might do 100 patients with this pharmacogenetic testing, and maybe only 5 or 10 get information that actually is different than what their treatment algorithm would have been, right? So you might get the test and get a report that says you're normal.
But if you are the 1 in 10,
right,
that could make a significant difference in your treatment.
Yep.
Well, what we want to do is partner with you along the way in this show. Have you come back and educate us as you launch new products. I know you got some things in the works.
Yep.
I didn't want to give it away yet, but we look forward to having you back.
Thank you so much. Good to see you.
Thanks for being here
Liz.
today. It's been
Thanks.
awesome, and we look forward to more. All right, coming up next, we have a little bit more information on my Facebook page on them and at local12.com, and we'll be right back.